Hi, my name is Chandler Clark. I am a student nurse at the University of South Alabama, and this is my injection site video. Here is my photo ID and my room scan. Okay, so the first thing I'm going to do is I'm going to show the deltoid injection site, which is a intramuscular injection site. So the first thing I would do is I would go 3 finger lengths down from the acromion process, which is the most lateral part of your shoulder, and then I would go below and make a V with my other hand, and that would be the deltoid injection site. Can I have you lift your arm to your side? So if you can see right here is the deltoid, and then where it goes back down, that is the deltoid insertion. So we want to make sure when we are giving a deltoid injection intramuscular that we are not going below this insertion line. So now I'm going to move on first I am going to say that when you give a intramuscular injection, you are going to pinch up the skin and the muscle, and you're going to insert your needle and aspirate on your syringe, and then you're going to inject your medication. So now I'm going to move on to the dorsolateral aspect of the arm. So for the dorsolateral aspect, we're going to go 3 finger lengths below the deltoid insertion site, and then 3 finger lengths up from the olecranon process, which is your elbow. And so that will leave us with this rectangle right here that is used for subcutaneous injections. So I could do a 45-degree angle injection or a 90-degree angle injection. So next I'm going to do the forearm injection site. So for this one, we are going to go 4 finger lengths down from the antecubital fossa and 4 finger lengths up from the wrist. And that gives us this rectangle right here. This is for intradermal injections. So for an intradermal, we are going to avoid all of the veins and tendons that we can see, and you would inject at a 15-degree angle, and you would be able to see the needle below the skin and the bleb, which would be the medication that you just administered intradermally. So now I am going to move on to the ventrolateral injection site. So for this one, I am going to slightly pull down the waist of the bottoms, and I am going to put the heel of my hand on the greater trochanter. You can find the greater trochanter by moving the leg, and you'll feel it up here. So I will have the heel of my hand on the greater trochanter, the thumb facing the groin, and my index finger facing the anterior superior iliac spine, and then my second finger and the rest of my fingers will be facing the iliac crest. So the V in between my second finger and my index finger, this little triangle is where the insertion site is, and that is where you can inject a intramuscular injection. It can take more volume, and it can handle larger needles than all of the other intramuscular injection sites. So it is the most desirable injection site for intramuscular injections, and you would inject that at a 90-degree angle. So now I am going to do the abdominal injection sites. So for the abdominal injection sites, I am going to lower the waist of her pants, and for the abdominal injection sites, we're going to stay below the costal margins and above the pubic area, and then we're going to stay in between the anterior superior iliac spine, so it gives us a box or a rectangle right on their abdomen, and we would go 2 inches away from their umbilicus, so that gives us a good bit of injection sites. So it is good for patients who take subcutaneous injections frequently, such as patients on heparin or patients on insulin. And since that is subcutaneous, I could do either a 45-degree angle or a 90-degree angle. So next I'm going to do the vastus lateralis. So for the vastus lateralis, I'm going to pull the pants leg up, and again for this one I will have to find the greater trochanter. So I'm going to put my hand right there, and I'm going to move the leg, and I can feel the greater trochanter moving right there. So I will go 1 hand's width below the greater trochanter, and then 1 hand's width above the knee. And that gives us this rectangle right here, where we go from the midline of the anterior portion of the leg and the midline of the lateral portion of the leg. So it gives us a rectangle right there. And that can be used for subcutaneous or intramuscular injections. So for the intramuscular, I would go at a 90-degree angle and I would aspirate, and for subcutaneous, I would go at a 45 or a 90-degree angle, depending on the amount of subcutaneous tissue. And for subcutaneous injections and intradermal injections, you do not have to aspirate, but you do have to aspirate for intramuscular injections to make sure that you are not in a vessel. And I believe that is all for my insertion site video.